I'm Nick Fish. Ben Westlund has a plan to reform our healthcare system. Will he also be a candidate for statewide office next year? I'll ask him next on Outlook Portland with Nick Fish on Portland CW.
It's Outlook Portland with Nick Fish, tackling today's issues that affect Portland and the surrounding area. Brought to you by Azumano Travel. Now, here's Nick Fish.
Welcome back to Outlook Portland. My guest this morning is Senator Ben Westlund, a Democrat from Bend, Oregon. Ben, welcome to the show.
Thank you for having me.
Now, Ben, when you were last on the program, you were a candidate for governor. You were running as an independent. You later withdrew. You went back to your day job as a state senator. And in my view, you've just ended a highly productive session of the Oregon legislature. But you're now focused on one of the biggest problems facing Oregonians, which is health care reform. And I'd like to spend some time this morning talking about the Healthy Oregon Act that you and Senator Dr. Alan Bates have pioneered and authored. Later, I want to talk about some of the achievements of this session, and then I want to ask you about your political future, in particular whether you consider running for the state treasurer job. But let's begin. What is the Healthy Oregon Act?
Well, first of all, it's a roadmap. It's a blueprint to achieve three things. And to put the healthcare issue in perspective, this is a crisis of enormous economic and ethical proportion. It is the largest issue facing not only Oregon, but this country, and if we don't solve it, this country will not, continue to exist as we are currently so proud to call America home. It is absolutely essential we address this for economic and ethical reasons.
Okay, so the basic components of the Healthy Oregon Act.
What we do within the Healthy Oregon Act is we set up a very comprehensive approach to, and we can do this, we will do this, lower cost, improve quality, and provide 100% access to health care for every Oregonian.
Now later on, we'll go through some of the questions that I think our audience will have about, cost, pre-existing conditions, a number of the specific components. But let's remind people about the magnitude of the problem. So today in Oregon, how many uninsured Oregonians?
615 to 620,000 human beings don't have health care, and of those, 117, 120,000 are children.
All right, we know that pool of people doesn't go without health care, so how do they get their health care?
Well, let's just be blunt and frank. I mean, we already have universal health care in this country. If you're uninsured and you get sick or break your leg, get lung cancer, you present yourself to the emergency room and get the most expensive medical care on the face of the planet, emergency room care.
And in fact, an eye-opening experience in Portland is if you do have to go to a hospital emergency room, let's say there's a cut or something after hours, the number of people that you see in distress who are struggling Oregonians who don't have health insurance, for whom this is their primary care, they don't have preventative care, but this is their primary care, is very sobering. And this, of course, as you've mentioned, is the most cost-inefficient service that we can offer them.
What we do in this country is we get to illness late in the disease cycle, not late in the life cycle, when it is much more costly to treat, and also the outcomes, the results are much poorer. That's the single biggest reason we have the highest healthcare costs in the world, and we are among industrialized countries. We have the lowest healthcare outcomes.
Now, the Healthy Oregon Act, as you said, sets forth a blueprint for the future. And what will happen, as I understand it, is a 7-member board will be appointed to take a look at all the options and report back to the legislature, correct?
That's exactly correct.
Now, when the final vote came up, it was 22-7. So tell me, why did 7 state senators oppose the creation of a board to actually look at this problem?
Well, let's take that one step further. It was 22-7. I think there was one absent in the Senate. The vote in the House was 52-5 opposed, 2 absent, overwhelmingly bipartisan support in the House, and certainly bipartisan support in the Senate. That's my chamber You don't ever want to be a prophet in your own land. So I think there's probably some additional resistance in the Senate. But still, I mean, it was an overwhelming bipartisan vote. We tend to focus on the Democrats and Republicans that voted for the bill as opposed to, the 7 souls that need a little bit more education.
Now, will the public have an opportunity to weigh in during this deliberations of this committee?
It is specifically called for in the bill that public input, both in terms of the state issues, and we have a federal subcommittee, and this is perhaps one of the most important aspects of the bill, is how we address federal impediments to providing effective health care in Oregon. It's going to be a very open, very inclusive process.
Now, Ben, a related piece of the health care problem we've alluded to earlier was uninsured children, and the governor and the leadership of the legislature made a priority around healthy kids, a proposal to expand coverage for uninsured children, paid for by an 85 cents per pack cigarette tax, which puts us in line with Washington and some other states. The tobacco lobby seems to have won round one because you couldn't in the House get to 36 votes. Tell me how big tobacco is able to scare legislators from voting to support health insurance for our children.
I think it was more than just big tobacco. I mean, I think it's difficult to pigeonhole or categorize the opposition to the bill in terms of just tobacco versus kids. That was certainly part of it, big tobacco versus kids. The other issue there is just the way representative democracy and the legislature works. Republicans found themselves in the majority for the first time, or the minority for the first time in many years, and that was the issue, that they chose to try to lever greater influence and greater impact, for their issues, achieve some of their goals. So it was more than just big tobacco putting a lid on this. Well, it was the negotiating point for.
But do you think, was it appropriate to hold children hostage to that negotiation?
I think it's an abomination. I don't.
And by the way,
not defending this.
And by the way, I've talked to Republicans, Democrats, Libertarians, big government people. Almost everyone I know seems to think that a tax on some behavior, cigarette use, which causes damage to human beings, where the tax dollars are then used to treat some of the fallout from the problem, is a prudent thing to do. So philosophically, there's not a big stretch here, right? To put a tax on a thing that adults are allowed to do, a behavior, cigarette smoking, but that has huge social consequences?
Well, I can only speak for myself, and I think it is very appropriate. And just look at some of the raw numbers. I mean, first of all, tobacco is the most destructive, deadly, expensive drug ever introduced into this society. You look at the numbers. I mean, illegal controlled substance abuse kills 20,000 people in America a year.
This is Outlook Portland. Please stay tuned.
Outlook Portland with Nick Fish is brought to you by Azumano Travel. Call or visit the Azumano location nearest you for your next vacation.